last year, I think, katong gipa-remove akong braces.
Before pandemic, and the procedure done was cleaning, and there was also consult.
My last dental visit was last March of this year, 2023, and I had my teeth cleaning and consultation.
My last dental visit was February this year. I had a tooth pasta.
My last visit to a dentist was a few months ago. I had my teeth restored.
Atong pagbata na ko, I think mga 5 or 6 or 7 kay nagpapasta ko sa kumipon.
Wala kay ko ka-remember ato, pero I think katong the first time nga naka-visit ko og kanang dentist is nakulbaan ko kay gipahigda ko niya. Ang akong nakita ra kay ang suga, and murag kanang makulbaan man jud ka siguro niya, knowing gipa buka akong ba ato. So yeah, murag kulba jud.
My first dental visit was when I was 7 or 8 years old. I had tooth extraction. It was a traumatizing experience since the procedure was not explained thoroughly. I remembered I cried a lot, and I was even scolded by my father.
My first dental experience was scary because I was afraid of needles.
My first dental visit was several years ago, way back when I was a little kid. I had my teeth restored. At first, I was scared and a little bit nervous because it's my first time, obviously. But after several minutes, I felt relaxed, happy, and okay with the procedure.
From what I remember, it was terrifying because hindi pa ko familiar sa environment, sa smell, sa instrument nila, at the same time. Scary siya nga, say, if ever say what nila sa iyong mga teeth.
I don't quite recall how young I was when I had my first dental visit. I had to go to the clinic because a tooth needed to be extracted, and I was really brave before the process began because though I didn't know what to expect, my mother had promised me to reward me with ice cream if I behaved during the surgery. When the dentist started to hold the anesthetic injection in, I was surprised of how big it is, and I was already anxious at that point, so I had no choice but to put my trust and cry afterwards.
My first experience with a dentist was extraction of my primary teeth. I was anxious and a little bit fearful during that time, but everything goes well compared to what I expected. That it's very painful.
I couldn't remember my first experience in the dental clinic, but I think it was to extract my first molar.
I remember that I was scared during that time.
I could vaguely remember, but the only concrete memory I have of being treated when I was a child was when I was sedated. I was sedated, rather.
And my first experience with my dentist is when I think I was about 7 or 8 years old. I was a bit excited and not scared compared with my brothers and sisters who were traumatized with their dentist. But with me, I was kind of excited because my perception before was when I went to the dentist, I would get an ice cream afterwards.
So my first experience with a dentist, it was an oral prophylaxis treatment. So I feel excited because it was my first time to visit a dentist and have my teeth cleaned.
Was more relaxed compared sa
Comparing sa both first time and the latest, what I can say kay pag first time kulba, pero pag second time na around kay wala na kay ko nakulbaan. Well, wala jud ko kulbain na kay kabaw naman ko unsay mahitabo, and yeah, pretty much it.
The experience I had during my first dental visit was way different from the ones that I had during my last dental visit recently. It's because during the time I was very young then, and I did not understand what the procedure was about. The purpose was just to relieve the pain, the tooth pain. That's why I needed to have extraction. But this time around, having had a number of dental visits, I now understand why the procedure needs to be done, and the pain tolerance is already higher compared to the ones when I was younger.
I was more comfortable in my last dental visit because I already knew what to expect.
Totally different because now nabaw na ko sa importance sa regular visit sa dentist and nabaw na ko sa technicalities when it comes to unsa ka important sa visit sa dentist.
Dental student, I believe nga na ako'y pagka-Franco-trip pagsaon na for my first dental visit. So I kanang ganahan ko sa surroundings sa dental clinic pagkabata, and now mas ganahan ko because of the knowledge that I have gained. And yes,
First experience ko na scary ko na kinag ko na akong parents, akong kids. But compared na kay ako yung biglaan, wala na akong experience. And regular naman ko check up.
When I had my first dental visit, I was still a child and I was still afraid of dentists. But now that I have already grown to it, I am more confident in opening up my dental problems to my dentists already.
So, on first dental visit na kay dugay na kayo akong bata, so katulog kayo ito. Kaya karoon ako naman, nakasabot ako sa mga kasi kung hotdog, so okay, hindi naman. Mas confident ka na.
My first experience as a kid was extraction, and then my latest is oral prophylaxis. And then, as a dental student today, I am more aware of the procedures and treatments and the steps of the procedures. That's why I am more comfortable with going to the dentist now more than how I was when I was a kid. Well, for my first dental experience, gigupot ko fluoride at today. Pero pag latest na, it was around 3 years ago or 2, odontectomy to. Because of my lower right na third molar.
First dental visit kay ang 6 goal ko, pero wala lang ako rin doon na ito kada kilak ko, handok lang na kuhan sa karoon na ko na experience na ko dahil na treatment niya na nag-dentistry ko, so na-compare ako na kuhan na importante yun taking care sa teeth, so this is the
As a child, I've always had this mindset that dentists are scary because of their equipment being inserted in my mouth, especially the syringe. So my first dental experience is tooth extraction. So after hearing the word extraction, I've always imagined that I will feel it in my mouth. That's why I felt really scared and uncomfortable. And in my latest dental experience is pasta. So I've had 3 pastas done. So after those 3 pastas, I felt really at ease and comfortable in my dentist appointment. So now that I'm already grown up, a teenager, 16 years old, I'm already comfortable going to the dentist rather than being scared. Thank you.
So my first dental visit was a complete disaster. I was terrified of every instrument that the dentist used, especially the anesthetic syringe, because of how big it is. And I was just a young child, and even before the procedure, it already feels as though it will kill me. My most recent appointment, I immediately feel more at ease around the dentist, and I talk to her frequently and ask her some questions, and I'm already aware of the procedure steps, and I trust my dentist that she will handle everything well.
Compared with my first visit and my last or latest visit is different because I already have a prior knowledge on what to expect during the treatment.
At my age, I am more knowledgeable with the procedure, so I'm more at ease during the treatment.
Of course, I was still a child when I had my first dental visit, so I had fear of going to the dentist. But as I grew, and as I have also a different dentist, I did not have any trouble because I'm aware of the procedures being done, and I'm also a bit braver since I'm, big.
It was very different because my first dental visit I had no clue of what was going on, and I had no idea what were the stuff used, and I was just there in the moment, and my parents were the one who was organizing everything, and right now I'm actually the one who gathers the information and tells the dentist what did I do, what my dental information, and that's why it is very different.
Actually, there was no difference because both dentists did well.
For me, in terms of dental materials or innovations, they are now high tech today than in the previous years. Right now, I feel more comfortable discussing the things that need to be done with my dentist about my oral health.
For me, the experience and knowledge I got during my visit makes a significant change.
In today's generation, I think there are many things that have improved in the dental practice, especially the use of technology in treating a patient.
For me, it changed a lot because before I was here because I was still a kid, but right now I'm big enough.
I think what changed was the scenery and the environment that I am with together with my dentist, and what stayed the same is their reassurances to me as a patient that I am able to get the best possible treatment without any severe or extreme pain.
The changes I would say would be in my part, the maturity I had with the dental, with my oral education, and the part of the clinic or the dental team, it's mainly of the amount of patients that have come and go, because when I was younger there were still very few of us, and the waiting would just be maximum of 1 hour, but now I would wait for like 3 to 4 hours.
The one that has been changed, my oral hygiene methods, because before I only used toothbrush, but now I usually incorporate wash and dental floss in my oral hygiene methods.
I think that my dental team should really focus on listening to their patients, since I felt like from my last dental visit, I was not heard by them. Since I was not heard, I
again in their clinic, because for me, effective communication and what I prefer as a patient is really important, since I am the patient, and I think that being heard about my concerns will lead to my satisfaction as a patient.
I think mas more at ease ang patients, like ma-relax sila during sa procedure kay kanang kabaw sa kung sige ba sa patient mag-communicate sige ba sa dentist mag-communicate ang dentist sa patient.
Well, important yun siya kay knowing how the teeth are supposed to be taken care of. I thought nga as long as mag-brush ko sa akong teeth 2 times a day, okay na. Where in fact, kailangan jud ka mag-dental floss, mag-mouthwash, stay alert ka sa mga sweets, di ka magpalabi para di ka magka-cavities. And yeah, and also like kanang magsikag pa-cleaning. Daghan jud kayo mga factors na kailangan i-consider. So it is really important on communicating with your dentist.
As a patient, it is important for the dentist to communicate, not just through patient education, wherein she's going to discuss to the patient the importance of the procedures that needs to be done, the process. Aside from which, she needs to communicate through communication. She will make the patient feel at ease and comfortable.
It is important that the dentist will communicate and be friendly so that I will not be scared and be comfortable.
It is important for the patient to hindi siya mahadlok sa patient niya. Aware siya. Tapos, na-i-trust na
For me, communication is very important to meet the desired for just bayad ka, syempre, dapat mag-communicate sa ikaw para nakuha naman mong gusto or nakikuha or nakikusto parang question sa dentist. So, para sa hindi ka maano para sa dentist parang tama.
So communication is very important with the patient and dentist relationship, right? Para build o trust ng patient sa dentist, and then para sa kabalo ang patient, kasi like muhatos sa iya sa dentist, and makabalo po ang dentist sa kung sa mo ganahan sa patient na nabitang. So para mas effective mas nindot ang ilang treatment plan para magtatay.
Thank you.
Important that patient and dentist should communicate well, and of course build that trust, and so that the patient will openly say to the dentist what sa iyang mga bati and personal experience, chief complaint niya, and will trust the dentist, of course, to proceed to the procedure na dapat sa patient. And then, I guess lang good relationship sa patient and the dentist. Thank you!
Mas nice yung communication guide. Kasi nagtanay mo ba? Na ay solid ka sa dentist. If na may good communication, sponsor, mga comfortable ka ba sa patient? Siyempre, communicate ka on parang sa dentist. Thank you.
Dentist and patient relationship is very important para mas sa patient. And then, mas mag-aware sila masalig sila mas sila ito ko yung siyempre wala ka comfortable sa
Thank you.
So I think there needs to be a communication between the patient and the dentist. There will be a friendly environment and there will be definitely exciting patient.
mag-explore sila o if mag-treatment sila kay asa unsa jud ilang i-focus, like is it aesthetics or sa function and
tell the dentist about what he feels, how he feels, and everything about it, about his having a disease, and I think her allergies, his or her allergies, and it is very important because for the dentist to apply or to treat the best possible way for the patient, and with this the dentist can easily diagnose or use the best possible treatment plan for the patient.
It's very important because it's about clarity, trust, and ensuring patients are well informed and comfortable throughout their dental journey. And also, it eases the patient's anxiety and builds trust.
Yes, my preferred environment for a dental clinic is like calm and relaxing environment so that the patient can get help.
So it is crucial to give a patient with a secure and pleasant atmosphere as well as friendly staff. According to the respondents' responses, their first dental experience was due to the fear of the dental tools they had seen when they were young, not understanding why they were there. Since it was their first time, being anxious and naive was a typical reaction, and the dentist must address this in order to prevent the child from experiencing distress at the following appointments. It is critical to explain in terms that kids can comprehend. In order to keep patients calm and establish a trustworthy environment, communication is crucial. In contrast to their most recent dental visits, the respondents demonstrated a good response, asking questions about the treatment they did not understand, and the dentist positively explaining it to them, making them feel at ease. As a result, our experiment has demonstrated the importance of communication between a patient and a dentist. Thank you.